In my opinion, Dr. Lozada uh, is a guy. At, I can, how can I describe him? He's a complete. He's a perfect guy for the position that he has.
Another one of our instructors that joined the program now for more than 15 years is Dr. Alejandro Kleinman. Dr. Kleinman was an individual in charge of the internship program. One of the things that we promote and develop in our implant dentistry program was other educational opportunities besides the formal certificate and master's track program. That first or additional educational opportunity was what we used to call at that time a preceptorship program. Later on, that program became known as the internship program. We needed instructors to help us handle that program and manage that program. And Dr. Alejandro Kleinman was the first person to help in recruiting students and then eventually manage the entire preceptorship program in implant dentistry. Other instructors that joined the program later on were Dr. Alarda, and a few others on a part-time basis too.
I met a lot of people from not only from U.S. but from abroad, from international. I can remember many good residents that they became really leaders in their professions. You know, a successful program, you know it by knowing what happened to the residents, to the residents that they graduated. And when you look at all these residents that graduated, most of them became the leaders in their profession. They take all the high standards of the Loma Linda education, and not only the education part, also that spirit, the Christian spirit that they learn it through their education and so on. I can name a lot. You know, I know that Dr. Milos Boskovic, Dr. Nick Kaplanis, Joe Kahn, and even a lot of fellowships like Dr. Musurkani, Dr. Mangia. Dr. Musurkani and Dr. Mangia was instrumental in getting not only the fellowship in implant, but also went to the PROS program, became a very good prosthodontists. And I was very impressed with their achievement and their behavior during their education.
Under the leadership of Dr. Patrick Naylor, we were able to initiate combined programs where implant dentistry was joined with prosthodontics, also with periodontics, so individuals could come and obtain dual specialization within that area of special interest.
Well, I started as the first combined resident between the prosthodontics and implant dentistry departments. And some of the key individuals then were Dr. Lozada, was the one who first approached me about the program, and he was my program director. Dr. Alejandro Kleinman was one of the, when it came to my surgeries and things like that, he was one of the main go-to guys that really taught me a lot. And of course, Dr. Joseph Can, was instrumental in really showing us how to do really high-end aesthetic implant dentistry, and constantly pushed us to achieve a higher level. Dr. Alarda was also, was also one of our tougher faculty members who always pushed us and made sure that we knew our literature and were ready for our procedures. And over the years, he and I have become very good friends.
The program really took off when we started the MS program. That MS track attracted a lot of students. Our first student enrolled in that program was Dr. Silvio Emanuele. He actually conducted a research protocol in collaboration with the orthodontic department. measuring orthodontic forces on dental implants. From that point on, we accepted more students, all of them enrolled in the master's track, and all of them producing very important pieces of research in implant dentistry. Some of the students are Dr. Oliver Hanisch in Germany, Dr. Nick Kaplanis, currently practicing in Orange County, Dr. Silvio Emanueli, of course, practicing in Italy, Dr. Istvan Urban, practicing in Hungary, in Budapest, and a few other doctors that and students that, with their research, have contributed significantly to the field of implant dentistry.
The implant dentistry program stands out because it has faculty with exceptional long-term experience at placing and restoring dental implants at a very high level. They have also been involved in their professional organizations. They have lectured, they have taught other individuals about implant dentistry and how it is performed at the highest possible level. They have run a study club for educating general dentists. They have taught specialists how to perform the procedures. We've had many live surgery courses here that have been broadcast around the world. And all of those characteristics of providing excellent patient care, having well-educated, knowledgeable faculty who give back to the profession, to their organizations, that's what makes a great program.
Whenever I think of my dad, I think of a line from a Ridley Scott movie, Blade Runner. And it goes something like this: a star that burns brighter doesn't burn as long. I think at 64, he died way too young. But he burned very brightly in his life.
Just imagine, 35 years ago, Bob James started with nothing, just with a vision, just a belief that implant will work. Now, he never lived to see what's happening right now, all right? And now, 35 years later, there are many days, when I reflect back. In fact, I sometimes tell my colleagues, you know what, if Dr. Bob James is still alive, I feel that he will be extremely proud, all right, extremely proud of, of the babies that he created, okay? The babies have grown up, all right? Not only grown up, but passionately push the envelope in implant dentistry to a level, into a world-class organization, all right? World-class institute, and put Loma Linda implant into this map here. I see that implant dentistry this 35 years has basically, came a long ways in many, many things. I remember when I was a resident, we're talking about almost 18 years ago. I remember the other university in Southern California, when they also deal with implants. I remember that many, many moments I hear things like, oh, Loma Linda, you guys are just a very small school, you don't have that capability, you're not at the same level. Again, when I walk around in meetings, I don't think I hear that kind of words anymore. In fact, all I hear is, we get showered by admiration, adoration. How much our program have put out, had helped the patient population. Again, is amazing. 35 years. I think that Dr. James, with this just a tiny little vision, I cannot believe that it had grown into such a powerful movement. And we're so grateful that Jaime Lozada continue on this movement there. And I feel that, the future of our implant program is so bright because we have, educated so many wonderful, wonderful students. And I believe most of them, they will carry this fire and just keep it burning for years and years and decades to come.
It's been 35 years of implant dentistry at Loma Linda University. And with those 35 years, more than 25 I have been part of this tremendous adventure here. Educating students, treating patients, and also looking forward to more research in implant dentistry. I think the future is bright, and our faculty and our students are all excited, and all the prospect students that are ready to come, we're ready for them. So I'm looking forward to more experience in implant dentistry.